Professor Carol McKinstry. I'm a Professor of Occupational Therapy at La Trobe University and also Deputy Dean of La Trobe Rural Health School. Due to the physically demanding and often traumatic nature of military service, over 500,000 Australian Defence Force personnel reported in the last census that they have a higher prevalence of physical and mental health conditions, such as depression, anxiety, substance abuse, arthritis, heart disease, respiratory disease, and also stroke. Occupational therapists work with former service members to overcome things such as sleep problems, anxiety, transition back into civilian life, so things such as work, study, but also leisure. These people often have difficulties or pain doing their usual daily activities and require rehabilitation and assistive equipment for this. So occupational therapists offer a whole range of different services to these people, and because of the complex and quite wide-ranging needs. We knew that this was an increasing area of practice, given the numbers, 500,000 Australians had served in the Australian Defence Force. Occupational Therapy Australia approached us at La Trobe University to conduct the study to describe what the current practice of occupational therapy was and what were the challenges for occupational therapists working in this area. We had 123 occupational therapists respond to our survey, and almost half of these were from metropolitan areas, while 28% were practicing in regional areas and 23% in rural or remote areas. Nearly 70% had over 15 years of experience, and 87% were working in private practice, which was quite surprising given the growth in this area. This is often where occupational therapists delivering these services are working from. Occupational therapists surveyed reported that while working with these clients was very rewarding, there was inadequate remuneration, which was making them question whether they could continue because this was not sustainable in terms of being a particularly private practice. And given the differences in funding rates with other compensable schemes, such as the National Disability Insurance Scheme, they reported that their clients had very complex needs and they were doing things like reports pro bono so that their clients could get the services that they needed. The administration requirements were challenging, and often aspects of occupational therapy service were not funded, such as things like contact time with family members or ex-service organisations. For rural therapists, travel time was not being adequately remunerated, but they felt a real obligation to provide these services because there was not really any other options for rural clients. The referral process for clients was also identified as a problem. It was very complex and stressful for the clients, particularly as general practitioners, and the clients themselves did not fully understand what the actual role of occupational therapists was. Therapists also reported that due to the complexity of practice, they needed more opportunities for specialist professional development specific to this population to really fully understand their complex needs and provide the best possible service. Conclusions of the study were that the Department of Veteran Affairs remuneration, the fee schedule, needed revision so that these therapists could continue providing these services, particularly to those in rural areas. Most professional development opportunities were limited, and so it was identified that there needed to be more specific opportunities to help them work with Department of Veteran Affairs clients. Next step, I suppose, to what future research is needed or action, it would be really good to compare our Australian data with other countries such as Canada, the United Kingdom, or the US, so that we can improve a range of services and provision of these services, so that we're better meeting the needs of former and current Defence Force personnel. In other countries, there are, I think, more developed services, and this would be, I think, fantastic for Australia if we could get to that. Some more advocacy by groups such as Occupational Therapy Australia to improve remuneration rates and to improve referral systems through advocating and working closely with the Department of Veteran Affairs is needed for future development.